Ladies and gentlemen, boys and girls, welcome to another session of podcast. I wish and I'm sure you will enjoy listening to the broadcast.
So, sir, what exactly is diabetes? Before we go into the types, etc., can you explain us what is diabetes, the condition called diabetes?
Diabetes is, in pathology, it's called diabetes mellitus. Okay, that's a word for it. And then diabetes is a variation in your glucose metabolism, which is away from the normal pathway of the glucose mechanism, glucose metabolism mechanism sets inside. We can call this as a not a disease, we can call this as a disorder. The order of glucose metabolism goes into disorder. You can take it that way, you know. If you're going to play with language around, you're going to scare people. So, diabetes condition, it's a diabetic condition, what do you call it? Or there are two parts of it. One is hyperglycemia and hypoglycemia. If you're going to fall low in your sugar, in your blood level glucose, it's not going to be good for you. It goes higher and higher, it's not going to be good for you. So this is how you can visualize it.
Since we're talking about diabetes as a condition of the body, is it a condition that's supposed to be permanent, or is it reversible through medication or through food habits or through lifestyle? Is diabetes a condition that can be reversed? Because people with diabetes would definitely like to be free of it or free from taking medication for their life.
Diabetes, if you go through the diabetic atlas today in the net, it is very scary. It's very scary, the number of people affected by this problem. Diabetes is more of a cultivated disease. Now, when it comes to the question of medical science, as a patient, if I am a doctor, as a patient, if you come to me, what is the parameter on which I am going to diagnose you and declare or classify you as a diabetic individual? This plays a major role. You understand? You just come to me, I just take a blood test and I see there's something number, this number, more than this number, you are diabetic. Okay, I write medicine and give it to you. Within 5 minutes, all over. That's what is happening. Is it that way? It cannot be, because bringing human chemistry under numbers are very difficult. But still we follow the regime. Okay? You follow this?
Yeah, definitely. Yeah.
So who has come out with this number? How can this number be the same globally? Okay, we'll come to the other side. If 20 years of age, your postprandial can be 140. When you go 50 years beyond and you come to 70 years, can I expect 140 as a postprandial?
No.
It is like you buy a car and drive it from 0 to 25,000 kilometers, it behaves fantastic. After driving that car for more than 2 lakh kilometers, will it give the 0 mileage performance?
No, definitely. The normal basis of what is normal will change with age.
Then how do you expect the human machine to work the same way as 0 mileage? Correct? And both blood pressure and this hypertension, whatever you call it, and then this diabetic condition or glucose level, the sugar level in your blood sugar, is a variable condition. You restrict it to a number and you expect the same number at the age of 15 and you expect the same number at the age of 70, 75. How is it possible? So when you cross a little number, there are people, suddenly they are recognizing a community in Germany, or all from the children to the oldest people of all age group are constantly having a blood sugar of 350 plus, and they are living a normal life.
Oh, okay.
There is a particular Raju community in West Godavari side, or all age level people of that community is having constantly 320 plus of sugar. They are living normal. So where exactly you have arrived at this number? It is not, as you said, it is not good for all parts of the body and all that. Some people, it affects the leg. Some people it affects the retina. Some people it affects the liver. Some people it affects the kidney. Some people it affects the cardio health, right?
Right.
So is it the disorder called diabetes mellitus which is doing the job, or to keep the blood sugar under control, you are constantly having medicine day in and day out? Is those medicine doing the problem? Is the question mark.
Oh, that's a very relevant question. So, is it really the more than calling it diabetes mellitus? Is it really the sugar or glucose in the blood that's the issue?
I would tell you this way. If you are going to have the first set of medicines which are going to slow down your liver, they try to slow down your liver to release the glucose to the mainstream of the blood. These medicines, they choke the entire liver, the entire function of the liver. If you're going to do that, then the vascularization part of the liver is, at a stake. If that's going to be at a stake, then your blood supply to the legs are going to slow down. Then the skin start getting blackened up. Then the diabetic foot sets in. Is it because of diabetes now, or is it because of the diabetic medicine?
That's definitely because of the medication.
Yeah. So where is the number? Number plays a lot of role. So, we have the brilliant educational curriculum called MBA.
Right.
These top institutes, MBA comes into corporates, and they put screens after screens after slides after slides. Every year they go on showing pictures that this amount of percentage of sales should improve, this many millions of rupees or dollars has to be the profitability to the company, projected balance sheet, this, that. They go on. Something like that has happened in this field also. They want to sell more and more medicine, they want more and more patients. That is why I asked you, what are the parameters followed? There are parameters designed and kept with respect to the diagnosis and classification of, classifying somebody as a diabetic individual. Is that exactly happens is the question mark.
So my next question to you would be, what are the parameters we should look at other than one single number says this is the glucose level in your blood? What is it we should be really looking at to classify a person diabetic and to take action? Really, is action, because as you give an example, there are people with high blood sugar levels but are leading a normal life and it's not affecting them. So at what point does it really start affecting a human where intervention in terms of medication or something is really required? What is it that we should measure?
First of all, you should understand one thing, that what is the, lifestyle that we have adopted to ourselves. Do you move around? All of us have become lazy. People feel doing household work is a disgrace. They want to sit with their computers, touch phones. Children don't go and play. Nobody does household work. Nobody cooks nowadays. Where is the body movement? Where is the exercise? What about your food? highly processed food, buying outside food and eating. You are not spending your energy at all. More and more you sit at home, more and more you tend to eat and drink juice. Too much of snacks. Where are you spending all this? So definitely your sugar level tends to go up, right? Yeah? So what is the way out? How will you analyze yourself? At what point you need to go? Okay, when we come to the question of glucometer at home, sometimes they have 30% variation. The medical science itself says capillary blood should not be taken into account. So how do we place ourselves to this point? The best way is for you to, equip yourself or protect yourself is only one. Is to make sure that you are conscious about what you are eating. Your daily lifestyle should be properly designed by yourself to live a healthy life. Those people who are born in 1930s and 40s and 50s are living now at the age of 70 plus, 80 plus and 90 plus. Most of them are not having diabetes. Do you agree to this?
Yeah, sir, yeah. The really old people, the ones in their 80s, etc., they don't have it. I think it's the 60s, 40 to 60 age that is probably the highest number.
Why the diabetes have not touched these people who are born in 1930s, 40s and 50s? That is because of your chemical world. Chemical way of agriculture. Chemical based agriculture. Pesticide based agriculture is taking a toll on us. Plus, parameters are not followed to classify you as diabetes, showing more numbers. We want more and more people to buy medicine and eat. So we want more of this disease. Simple.
So actually it's related to this question a little bit. So what are the types of diabetes, if at all we should classify a person? We hear type 1, type 2, and there's gestational, there's diabetes in children. What are the different classifications really of diabetes, and what is it we need to take care of while really classifying a person saying this type of diabetes? Or today it's just one standard diabetes, but what are the classifications we can look at?
See, diabetes are, as you said, type 1 is there. Type 1 is nothing other than pancreas are not coming out with enough of insulin. So the transport of glucose is getting affected. Type 2 is insulin is there. They say yes, human cells are getting resistant to insulin, so the glucose are not getting transported. Gestational is a small thing when you are when you are pregnancy. You get into higher glucose levels, which after pregnancy it goes off after the delivery of the child. Juvenile diabetes is it's affecting the young children. They are more so type 1.
It's type 1.
Yeah, but the reason for diabetes mellitus is unknown. So we play around with the mechanism inside without knowing what we are doing.
How did ancient Tamil science view diabetes? Was diabetes a condition classified separately in the ancient times?
They do have this problem in the pathological classification of the ancient Tamil science, no doubt whatsoever. It is called Madhumegam, that is blood sugar, higher blood sugar. It's called Neeridivu, the urine sugar and all that. They had perfect treatment for it those days. Yeah. You have fantastic low glycemic index rice, varieties of rice were there, because after the age of 50 you move into different type of rice, breed of rice. After the age of 60 further, after the age of 70 further, and they all brilliantly used the technique of fasting to recorrect yourself. Fasting recorrects your mechanism. You know that?
Yes.
So you've spoken in detail beautifully
Yeah.
about it when we did the video on fasting.
Yes.
So they had fantastic lifestyle system. When you get into these kind of things, they reverse you within no time,
Okay.
which we don't have it now.
Thank you very much for spending your quality time. Thank you very much for your attention. I wish you enjoyed this session. See you later.